Are you on medication for your mental illnesses? How do you know that they're the right medications? Have you had to switch a lot to find the right medication? Have you just given up and gone off of your medication? Yeah, I'm looking pretty rough. I haven't gotten my shower in because I've been dealing with Amazon for the past 12 hours, and I've had it. And I've been wanting to do this video since I got up this morning and took my medication and thought, that'd be a really good topic to touch on, because in the years that I have been in therapy and have had different psychiatrists, they have tried so many medications. And it started out with antidepressants, and they didn't work. And it was years and years of antidepressants, different antidepressants. And then I would switch therapists, I would switch psychiatrists, and it'd be more antidepressants. Well, then I finally was diagnosed with borderline personality disorder. Come to find out that antidepressants won't work. No, let me back up a second. I'm sorry. I was diagnosed with bipolar. I have borderline too, but I was diagnosed with, oh my God, my head is still just spinning. I listened to some music to try to calm down, and it really hasn't worked. I was diagnosed with bipolar, and antidepressants don't help and don't work with bipolar. So for many years, I've been thrown antidepressants. And it's no wonder they didn't work, because they don't work with bipolar. So then you have to find a doctor that knows more about borderline and bipolar to understand, because believe it or not, there are doctors out there that don't realize antidepressants don't work with bipolar. It's just amazing to me that they don't know that. There's a lot of things that I found out over the years that doctors don't know. They just don't. I don't know if they're just, I don't know. But what I do, and I found effective, yes, I actually found a cure. I shouldn't call it a cure, but I actually found a solution to the issue when you're prescribed a new medication. The first thing I do is Google the medication. Yes, I Google it. I find out the side effects. I find out if that's a medication that's normally prescribed for bipolar. Because borderline, there's no medication. They say that there's medication, but I've read so much about it that there isn't. They have things that maybe can help with some of the symptoms, but there's no medication like there is for bipolar. So I'm damn near hardly out of the parking lot with a new medication, parking lot of the pharmacy, and I'm checking out this new medication, because after being prescribed so many different medications, I don't trust the system anymore. I don't trust the system, period. There's nights that I fall asleep, I don't take my medication, and I wake up in the morning and I'm like, yeah, I guess I should take them. And I'm not saying don't take your medication. That's not what I'm saying. I'm just saying that, like, the medication I'm on is a mood stabilizer as well as medication for seizures, because I have pseudo seizures. They're not like epileptic seizures. They're a different kind. If you want to know really what they are, you can Google that and investigate that. If you have, some kind of seizures that you're unsure of, or some kind of things that don't make sense. It could be. It just happens that's what I'm on. And I'm surprised I haven't had any seizures lately after skipping my medication. And I tell my therapist that, just because I'm so fed up with the system. I believe I've been in the system for 39 years, and I've been to the point of sick and tired of them treating me like a guinea pig. Oh, you have that? Let's try this medication. Let's try that medication. The side effects. That's one thing you have to be aware of, and something you have to address to your doctor. That's part of the issue. If you're having side effects that are bothersome, great or small, it doesn't matter. Address them with your healthcare provider. Because there are medications that have immediate effect. There's different kinds. There's ones that have immediate effect that will help and make you feel better, if you want to call it that, right away. There's ones that take a week before they have time to take effect. There's ones that take 2 weeks because they have to build up into your system to get to a certain level of therapeutic. I hate it when I can't think of the words. I can think of the words. It's, the therapeutic level. So there's certain medications, like I'm on lithium. Lithium is a mood stabilizer. I have to go every 6 to 12 months to have my blood drawn so they can look at my levels. And there's certain, if you know anything about having your blood drawn, there's the normal spectrum that you should fall in, and then there's ones that are over the normal spectrum, and then ones that are under. And you want to be within those parameters. So then your doctor will look at those parameters and say, okay, you're on a good dose. Now, a lot of medications don't have that. Lithium just happens to be one. Lithium is also one that you can't take NSAIDs, such as Motrin, such as ibuprofen. Medications like that you cannot take because you can have kidney damage, kidney failure. There can be very severe consequences of taking medications. And they always say when you go to the pharmacy, they're going to cross-reference your medications to make sure none of them clash. No, maybe back in the day, not today. Here's your medicine, goodbye. Is this new medication? Is this a refill? That's about it. Normally, I have experienced that they don't cross-reference your medications to see if they clash, to see if taking this medication and this medication together could cause harmful side effects. That's why you need to drive the train. You need to know what medications you're on, what side effects that can be caused, and what medications shouldn't be mixed. I know that there's medications that you shouldn't take and drink alcohol with because it enhances their potency, which I always tell them that's not a bad thing, but really I'm trying to be serious. But it's hard to when you've experienced so many different medications and I don't want to say experimented, but you know your body well enough to know this medication is not for me. I should be able to go to my doctor, express to them this medication is not working for such and such reason, and not be afraid of the consequences. I shouldn't call them consequences, but the reaction that your doctor has of, they may say, okay, you've only been on it a week. It could take up to a month before it's fully in your system and working. Now, then again, they might say, okay, you've been on it for a week. It should have been working within 3 days, 4 days. I can see it's not working. Let me see what else there is that we can try. And a good psychiatrist, which I had, which I don't have anymore, but I did have, she went so far and beyond of trying to find me the right medication that worked for me without the side effects, that she threw her hands up in the air and she says, I don't know what to do with you anymore. But sometimes it's just a matter of, okay, we found the right medication, but we have to tweak the amount and the dosage and the time of day that you take it. If it makes you drowsy, take it before bed. If it wires you, which I'm on right now, take it in the morning. If you're having, breakthrough anxiety during the day and you're allowed a certain amount of that medication in a day, then go ahead and take one to help with your anxiety. Thanks, Sasha. They're hungry. But there's always something. If you've watched my videos, there's always something that has to go awry. If it's not a notification, it's something. It's so annoying. I should just kick them all out. Right? You can't see her. She's down farther. Sasha, go lay down. Go lay down. So it's like almost impossible for me to make a normal video. If it's not notifications, it's pets, it's fiancés busting in, it's I'm falling asleep, it's my audio stops working halfway through a good video. It's always something, and I just have learned to go with it. Just like, for instance, now, Sasha interrupted me. She's a dog. She doesn't know what I'm doing. Oh, well. If you can't understand that, that's on you. I just have to roll with it. I try to do the best I can. I think I'm going to go after this and immerse myself, try to drown myself in a shower. I've never known anybody. I have never Googled it to see if you can actually drown yourself in a shower, but I can try. And of course, I'm joking. Suicide is not a joke. But you get to a point, especially with mental illnesses, and borderline personality is a big one. If you Google the hardest mental illness to, I can't remember what it said exactly, but to treat and deal with, it's borderline personality. And I'm so deep into it, I'm so sick of it, that I tell my therapist, I don't want to be here anymore. And then I have to explain that I'm not suicidal. It's just, I feel like life is just too difficult. And then I have professionals that don't know what the hell they're doing. A med change and a withdrawal of a medication and all that. You should not see the doctor one time in 3 months. They should check on you at least after a month and see how you're doing and make adjustments. Medication is such a huge factor when it comes to mental illnesses. Yeah, I lack sleep. I have depression. It's winter. The lack of sleep makes my brain diminished. My thought processes diminished. Makes it difficult for me to make good videos. But, I try to give advice from personal experience, advice from research, just everyday bullshit. Is there such a good day? There is such a thing as a good day. I have yet to find it. But I also have physical limitations and physical things that don't help. and I can't find a doctor to help me. And that is a huge problem. I can ask people, I can talk to my doctor, my family doctor. I need to get a family doctor who's an MD, because right now I have a nurse practitioner and she knows about Band-Aids and maybe fevers. She doesn't know what I need. I have edema in my legs so bad. My toes don't bend. My legs are quadruple the size that they should be. The pain goes up over my knees. She put me on medication and it helped. I don't go off track here, but I don't care. I'm just explaining why I'm kind of a crab, why I don't have good days. It's not just the mental part, it's the physical part. And mental illness can cause physical ailments as well. So, my pain goes over my knees and I'm afraid to call her, and it's going to be ridiculous. I don't want to be on more medications. I'm so sick of medications. I skip my medications if I can, because I just hate it. I either hate the way that they make me feel. I just, in general, hate taking them. Sometimes I feel like they're not doing me any good, that I could do better without them. But then one is to help me with my seizures, and I'm afraid my seizures will come back if I stop taking it. One's for my thyroid. I don't want to have issues with my thyroid. One's for PTSD. One's for IBS. One's for, it's like I have a whole fucking medicine cabinet of pills that I just try to avoid. And it's not so much symptoms and side effects anymore. I shouldn't say symptoms. I didn't mean that. And see, I do my videos off the cuff. I don't edit them. I'm just me. So I make mistakes. But anyway, the side effects sometimes are so irritating. You just don't, we can be driving and I'll just pass out. I'll just go to sleep. David's learned, just let me sleep. I'll wake up and say, where the hell are we? And that happens all the time. And that's just it. Insomnia is a huge factor for me. It's a huge problem. I'll be sitting right here in my chair and pass out. I've done videos. I don't know if any of you have seen them, because I don't know if I posted them, where I've actually fallen asleep while making a video. So lately I've been trying to do them earlier, when I'm not so drowsy and not so sleepy, not so sleep deprived, which is like a lot to ask for. But I just wanted to come on and talk about medication, because that is a really big part of mental illness, and you needing to find the medication that helps you, the medication that your doctor is prescribing you being a medication that's helping you. Because there's medication that can make you worse, make you hallucinate, make you suicidal, make you have headaches, make you have stomach aches, so on and so forth. I think you get the picture. But yeah, I just took my medication this morning, and I had not done a video about medication yet, and it's an important part of having mental illnesses. So I hope you take the time, and I hope you have a doctor who gives you more than 15 minutes on a screen, that gives you the time to talk about it and try different medications if one's not working. And like I said, most definitely look up the symptoms. And not the fucking symptoms. Why do I keep saying that? The side effects. Because the side effects can really play a big part in how you end up feeling. if they make you dizzy, if like I've mentioned some of them, those are the big ones. I've found that they make you dizzy or sleepy or things like that. And sometimes those side effects can be simply fixed or helped by a dose change, by when you take them. So I hope that this video helps you. If it does, I'd appreciate a subscribe. I'd appreciate a like. Um, if you want to leave a comment with a question, let me know if you've been on medications, if you've had problems with side effects, if you've had, if you have any questions for me, anything like that. Just, a little bit of interaction on my video, because I know they're not great, but, they are what they are. And I always hope that they help somebody. And I hope it's warm where you are, because it's not where I am. So I try to do my best, and that's all I can do by what I know. And right now, I'm following the advice of a pediatrician for what it's worth. So I hope you have a wonderful weekend and have a stress-free weekend. And I know that's a lot to ask for when you're in a position that a lot of us are. Today's society is a tough one, and having mental illnesses are very frustrating, very difficult. So thank you for watching, and have a great weekend.